to the Gallup poll, the answer is nurses. In fact, they've topped the list of most trusted professions for 10 years running. But it turns out not everyone who claims to be a nurse really is. Investigator Jessica Chapin shows us how to spot a fake in this Not in Your Side Consumer Alert.
It's a profession where lives are at stake. But even in the field of nursing, there are those who may care more about a paycheck than the patient. Nurse imposters.
I think there's high potential for harm. These are individuals that don't have the appropriate knowledge, background, credentials.
Arizona Board of Nursing spokesperson Valerie Smith says the board has caught 99 nurse imposters in the past 10 years.
When you say that you're a nurse, the public tends to trust you.
But the board says the supposed nurses on this list betrayed that trust. They're people who fake a license, steal someone's certification, or simply try to get by without one at all.
Part of that is the economy. Part of that is looking in healthcare, that you open up the newspaper and where are their jobs? There's jobs in healthcare. I think desperate times brings on desperate behaviors.
While some have medical experience, others are just in it for the access.
On a rare occasion we have seen where there's been a case of stolen identity where the purpose is to financially gain by accessing patient information and taking on the identity of those patients and taking out loans, credit cards, etc.
Smith says it's up to the employer to check credentials and watch out for several red flags like an inconsistent resume, names that differ on documents like the license and transcripts, providing copies instead of originals, and if a nurse doesn't have the skills they're supposed to when they start work. Another easy way anyone can verify a real nurse is to check with the board's website. Simply type in the certification number or the nurse's name and get a copy of their license. Maureen Fishman with El Rio Community Health Center helps screen their 25 nurses on staff.
It's important for patient safety. Our number one concern here is patient safety.
We asked how they check up on nurse applicants. She says they use the online verification, but they also go to the nurse's school to confirm their degree, and they recently formed a separate credential committee that confirms certifications. And even after a nurse is officially on staff, they're under close observation for 90 days.
When we do hire them, they have to, in their probationary period, they have to demonstrate the skills that they say they have.
They are all steps Smith says every employer should take, from large hospitals to in-home care, giving the nurse a checkup before they check in. Jessica Chapin, KGUN-9, on your side.
Posing as a nurse is a Class 6 felony. The Arizona Board of Nursing also releases a journal to all hospitals around the state that includes an updated list of those nurse imposters. If you'd like to see the list, you can go to our website, KGUN.